My son has told me before, and I'm not making this up, I hope other children who have healthcare workers for parents don't have to live like this. And you know what? He might have a point, because after working in healthcare for more than 25 years and spending so many of those years as a nurse practitioner in emergency medicine, I have realized something about myself. I don't always leave the ER at the ER. Sometimes I bring it home. And unfortunately for my son, sometimes I bring it home and I put it right across his computer. Literally, condoms. Yes, I did say condoms. And we are going there today. Hey, everybody, it's Kisha Pickford, and I'm a nurse practitioner, and I've worked in healthcare for more than 25 years. Much of that in emergency medicine. And this channel is really just a little piece of my world. Being a nurse practitioner, being a mom, being a woman, working in healthcare all these years, and the things I've learned along the way. And sometimes just what's going on in Kisha's head. And lately, I've been wanting to share more of that personal side with you, because there's Kisha, the nurse practitioner, and then there's just Kisha. Although, after all these years, I'm beginning to wonder if I can completely separate the two. Because, y'all, I see too much. And apparently, my family has to suffer because of it. Now, let me give you an example. Working in emergency medicine, I have taken care of a lot of sexually transmitted infections over the years. And I mean a lot. And when you repeatedly see what can happen when people don't protect themselves, that stays with you, especially when you're a mother. And my son, who is an adult college student now, but he's still my baby. And every so often, I'll get condoms from my primary care doctor's office. Sometimes she just has them available and hands them out. And what do I do with them? I bring them home and I lay them right across my son's computer. Not one, but multiple. But, there's no ceremony. There's no gift bag, no little card that says, "Love, Mom." I just say, "Here you go, sir." And this is not something that happened one time. No, I might do it once or twice a month, because I'm thinking about what I see. I'm thinking about sexually transmitted infections. I'm thinking about HIV. I'm thinking about people who had no idea that their partner had an infection. I'm thinking about everything I've seen over all these years. And then here comes Mama Kisha with another lecture. Please protect yourself. Take responsibility for your own sexual health. Don't assume somebody doesn't have an infection just because they look okay or they look healthy. And yes, Mama Kisha might occasionally add a little extra commentary that nurse practitioner Kisha probably wouldn't put in the patient education materials. And since we're talking about this, I want to make something clear. I am a Christian. My faith is important to me, and I'm not promoting premarital sex. My son knows what I believe. He knows what I've taught him and the values I've tried to raise him with. But I'm also his mother, and I'm a nurse practitioner who has seen a lot more over the 25 years in healthcare, seeing quite a bit. So while I can teach my son my beliefs and tell him what I hope for him, I also want him to have the information and the tools to protect his health and make responsible decisions. Now, for me, those things don't have to compete with each other. I can pray for my son. I can teach him my Christian values. I can tell him what Mama believes, and I can still put the condoms on the computer, because at the end of the day, he's an adult. He's a college student, and I can teach, I can guide, I can pray, but I can't make every decision for him. Now, my son needs to give me a little credit and some grace, because I've gotten better over the years. There was a time when the condoms weren't the whole presentation. Once upon a time, we had visuals. I mean, visuals. Yes, I would show him pictures of what sexually transmitted infections could actually look like, actual visuals that were in my medical books of infected private parts of various men and women. And it was a whole educational presentation. But I've since retired the visual aid portion of that program. And, I don't do that anymore. Now I might just describe in general terms something I've seen or taken care of, which according to my son, probably isn't much better. That's how we ended up with him saying, I hope other children who have healthcare workers for parents don't have to live like this. Well, baby, I'm sorry, but I see too much. And, it's not just about the sexual health. It's not just about my son. It's my whole family. I can take care of somebody with diabetes, and I see the complications that can happen when diabetes isn't controlled. And suddenly I'm thinking about somebody I love. I can see somebody dealing with complications from uncontrolled high blood pressure. And now I'm wondering, did so-and-so check their blood pressure today, or are they taking their medicine? When was the last time they went to the doctor? I can take care of somebody around the same age as one of my brothers. And now I'm thinking about my brother. And sometimes these people haven't done anything. They're somewhere minding their own business. And meanwhile, I'm coming home carrying something emotionally that they never saw. And now they're getting a phone call from me. And I think that's one thing families of healthcare workers may not always understand. You didn't see what I saw. I did. I saw this today. You didn't see where something seemingly small can sometimes end up. I did. So when I'm fussing, and yes, sometimes I'm fussing, there's usually something underneath all that fussing. Sometimes it's fear. Sometimes it's worry. Sometimes it's love. And sometimes it's me thinking, I know where this can go. I've seen people wish they had taken something more seriously. I've seen people wish they'd made a different decision. I've seen how quickly somebody's health or somebody's entire life can change. And when you love somebody, it can be very hard to turn that knowledge off when you walk out of the hospital. But my family isn't my patient, and that's something I still have to learn after all these years. Knowing what can happen doesn't mean I can control what happens. And knowing more medically than somebody I love doesn't mean I get to run their life. That's a hard one because I'm a fixer. I've spent most of my adult life being the person people come to when something is wrong. I assess the problem, I figure out what's happening, make a decision, and I do something. That's what I do. But my family doesn't necessarily want nurse practitioner Kisha walking around 24 hours a day. Sometimes my son just needs mama. My brothers don't necessarily need another healthcare lecture. Sometimes they just need their sister. And sometimes I have to remind myself, Kisha, they are not your patients. And this is also where my faith has to come into picture. I'm a Christian. And one of the things I'm continuing to learn is that trusting God with the people I love means accepting that I am not God. That's easier to say than it is to live sometimes, because when you've seen what I've seen, you want to protect everybody, but you can't. And Proverbs 3 verses 5 through 6 tells us to trust in the Lord with all our heart and not lean on our own understanding, but to acknowledge him and allow him to direct our paths. And sometimes for me, trusting God looks like saying, Lord, I've taught them what I know. I've tried to give them wisdom. I've tried to give them the tools. I'm praying for them. Now help me trust you with what I cannot control, because I can love people. I can encourage people. I can educate people. I can pray for people, but I cannot control every decision they make or everything that happens to them. And if I try, I'm going to drive myself and everybody crazy, especially myself. So has the ER changed my parenting? Absolutely. I think working in the emergency room has made me more aware. It's probably made me more cautious. It's definitely made me more likely to give an unsolicited healthcare lecture. And maybe sometimes it's made me worry more than I need to. But it's also made me realize how precious the people I love really are. When you've spent years seeing how quickly life can change, there are certain things you just don't take for granted. So yes, son, I apologize, kind of. The pictures have stopped. The lectures, well, I'm working on those. But the condoms, those are probably staying. Son, use the condoms. And if you're a nurse practitioner, a doctor, a paramedic, a respiratory therapist, or you've spent years working anywhere in healthcare, I want to know, do you bring work home like this too? Do you see something at work and immediately start thinking about your children, your spouse, your parents, your siblings, or even yourself? And even if you're not in healthcare, maybe there's something about your job or your life experiences that affects the way you love and protect your family. Tell me in the comments, because I have a feeling my son is not the only child who has had to live with a healthcare worker parent who sees too much. And as I always like to say, I don't know who will see this video today, tomorrow, or years from now, but this is my perspective based on my experience and the information available at the time I'm sharing this video. You know, healthcare is always evolving, so always follow the advice of your own healthcare team for your specific situation. Until next time, take care of yourself, and I'll see you in the next video. Bye.